Hi everyone and welcome to this session where we will talk about Pink October. My name is Clementine Gauthier. I'm SVP of ESG and Corporate Social Responsibility at TP, and I'm extremely happy to welcome our participants today, Triantafilos Alexopoulos, the Chief People Officer at TP in Greece, Dimitra Aggelopoulou, HR Vice President at TP in Greece and breast cancer survivor, and Christiana Mitsi, who is the director of Greece Race for the Cure, psychologist and head of scientific programs at Alma Zois, the Hellenic Association of Women with Breast Cancer. So as you may know, October is the Global Breast Cancer Awareness Month. It's held every October to promote early detection, prevention, and support for those affected. Breast cancer awareness is not just an individual health issue. It's really a societal and corporate responsibility topic. And I'd like to set the context before we move on to the conversation to illustrate the importance. Breast cancer is the most commonly diagnosed cancer in women, accounting for about 1 in 4 female cancers. It's also the leading cause of cancer-related deaths among women, responsible for 1 in 6 female deaths globally. On average, 1 in 20 women worldwide will be diagnosed with breast cancer during their lifetime. And we know that prevention is key because up to 25% of cases are linked to modifiable lifestyle factors such as a healthy weight, exercising, etc. And early detection is also another key driver as routine screening, mammograms, clinical exams dramatically improve survival rates. So now that we've set up a bit the context and the stage, we will now discuss how companies can play a vital role in promoting breast cancer awareness and prevention. And we will share more particularly the great example from our colleagues at TP in Greece, who have now dedicated more than 10 years to promoting awareness and supporting health of employees and their local communities. So Triantafilos, I will turn over to you and ask you perhaps why is a sustained and on-the-ground work, such as offering screenings, hosting awareness events, so critical for long-term impact?
Thank you, Clementine. Thank you for the invitation. Yes, it's very critical, and I think TP has understand this. We are a people company, so by supporting Epic October shows that TP commitments to our employees' health and, of course, to our community impact. Now, for the last decade, this has been started 10 years now. It's a journey that we have decided to provide not only theoretical part, but practical actions to our employees. This program separates to two categories. One is the internal and the other one is the external. We have the campaign free breast ultrasounds program which is part of our internal campaign. That for more than a decade now, TP Greece offer a free breast ultrasounds to every employee, regardless the age or the gender. Now, over the past 8 years, what we have recorded, we have recorded all these actions, and the registrations have been more than 7,000 of our employees, and the completion is under the 75% of the completed ultrasounds for this event and initiative. Now, about the community ultrasounds programs, because after our internal, we thought that we have to put our impact also to the society, and that's why we initiate the community ultrasounds program, which since 2021, we have expanded our commitment by offering more than 1,000 free ultrasounds per year to a woman across all Greece, not only in Athens, not only where we're outside, but across all Greece. The total impact of this initiative was that we had more than 4,000 registrations and more than 2,500 completed ultrasounds. Now, what is the key lens of these actions that make us to strengthen and continue this program is that we identified some cases of our existing employees that without this initiative, they have not been aware about the issue that they face with their health. So this is something that boosts us a lot to continue and improve all this program. The key lens is that we saw that even we offering these free ultrasounds, the ladies, and I mean the women that have been participating, they are not complete as we expected, more than 90%. So what is the key learning is that we need to educate more the people and more our employees, not only to receive as a benefit these free ultrasounds action, but also to complete the ultrasounds and continue these prevent actions that they have to do. So that's why we go to the next step, which is actually the awareness and education that except from offering ultrasounds, we need to increase all these actions about the awareness and education. And didn't stop only to women, but also breast cancer can also affect men. So so the program was access also for all our employees, even from the gender or from the something else. And that becomes an internal benefit, which involved into a national initiative supporting thousands of women all over Greece. About the awareness and education campaign, we combine the medical prevention with emotional education support. So some examples that we organize, and we have also now the last years, our annual Peak October panel, which is involved doctors, psychologists, and we had more than 50 participants per year. And the discussions about the early prevention is very, very important, which also involves emotional resilience, the identity, and the recovery also plan. Then we had also the Wear Pink Day, which is actually it's a more fun and activated across all our sites in Athens, Chania, or Moschato, or Thessaloniki, which is actually all our employees wearing, this pink flag and take photos to communicate outside the importance of this campaign. Internal storytelling and communication through our employees, and of course with Alma Zois, with our NGO, with our volunteer action supporting actually our employees, the Alma Zois, and the race for the cure support and participation by our employees. So I think that we are consistent and we are lucky that we have this campaigns by Pink October, and we will continue to force about that.
Thank you. And that's extremely amazing, really, to see how consistent you have been in all of the steps you're taking and the exhaustive thinking you have been around it, including action, but also awareness, etc. So it's NGO inclusion too. Now, Dimitra, as we said at the beginning, you survived breast cancer yourself, and we're extremely thankful for your participation today. About sharing your personal experience, and maybe tell us as well why consistent prevention matters.
Sure. So a couple of years ago only, I faced one of the toughest challenges of my life. So it has a name, breast cancer. It changed everything, how I see health, how I see time, how I set my priorities. So it was identified in a time that definitely was not expected. So there wasn't any prior notification from my organism that there would be an issue. So that came as a big shock when I was diagnosed. One Thursday night, after multiple ultrasounds to verify and validate again and again from my doctor that in the mammogram that this is the case. So we decided immediately that this is a high risk cancer. I had actually 3 tumors, and we needed to remove them as soon as possible. So next day, with the support of my colleagues here in TP, we arranged everything. And in 2 weeks from that moment, I had my surgery. But the journey didn't end there. So after a month after the surgery, I had to have chemotherapy as well. So I had 16 exhausting chemotherapies that held almost 6 months. All with the support of the company. I think without TP on my back, I wouldn't have managed to go through this, not only critical from a health point of view journey, but mostly from a mental health point of view. Because the first thing that people think when they hear cancer, they believe that death is coming on the way. This is not the case. So the fact that we found it at a quite early stage, the fact that we reacted, I wish prevention was in my life earlier. I wish I could hear the signals that TP was showing all those 10 years. So since 2 years now, Pink October for me is not just a campaign. It's not just one more event. It's personal. We should not expect for a wake-up call. We need to all understand that prevention can save lives, maybe ours, maybe a colleague of ours. So it's very important to be committed, to be precise, and to follow the opportunities that TP is giving to us to do those exams on time.
Thank you so much, Dimitra, and it's really emotional as a testimonial. You mentioned a lot the support from the company, which was key in prevention, but also in action and community commitment. TP Greece is also participating in the Race for the Cure. Could you maybe tell us about that event too and how it resonates?
Yes, definitely. So this is a TP family event, I would say. So we gather all together, men and women, once per year at least, and participate to this event that is organized by Alma Zois. And as a company, actually last month we had the biggest participation ever, with more than 600 employees running for a very important cause. So last year, that it was just after my chemos, I could only walk the 2 kilometers. I didn't run, but I set a goal, a resolution for 2025, and this year I managed with lots of practice and many changes in my personal health lifestyle, and I could run actually the 5 kilometers, and I'm very proud of that, together with my family and my TP family, for a goal. So, and I am really proud to be an ambassador. I consider myself at least an ambassador of this opportunity, in order to inform everybody that we can mention breast cancer. It's okay. We can fight it, and we can prevent it.
And that's an extremely powerful message. Thanks you again, Dimitra, for this testimonial. Christiana, so you're representing Alma Zois, the Hellenic Association of Women with Breast Cancer. TP Greece has partnered with you for 8 consecutive years now. Could you tell us what impact you've seen from this sustained collaboration, and why is continuity so important?
Okay, thank you, Clementine. Thank you for the invitation of being here with you today and giving us the chance to discuss about the impact that our collaboration has throughout the years. I'm here in order to represent Alma Zois, Hellenic Association of Women with Breast Cancer, which is actually a patient group. Since all the members of the association, the board of directors, are breast cancer patients and survivors. And our main goal is to actually end mortality from breast cancer. And this is done through our work since 1988 here in Greece, by focusing on awareness campaigns, by focusing on support, psychosocial support, legal support, practical support for patients and their families, and at the same time doing advocacy work here locally in Greece in order to change health policies that happen here in order to deal with breast cancer and provide better health care to women in need nationally. So when it comes to awareness campaigns, I cannot help but talking about Greece Race for the Cure, which actually for us is the biggest awareness campaign that we hold here in Greece. Actually, it's the second biggest race after the marathon. So it's a very important and a very special thing for everybody here. It's an awareness that, as Dimitra said, becomes really personal to every one of us. And it fights the fear, it fights the shame that comes with a diagnosis of breast cancer. And at the same time, it's a campaign that actually provides us the funds to implement consistent programs throughout the year for breast cancer patients and their families and the general public. So it was 8 years ago when our roads crossed with TP in Greece. And since then, together, we have made an impact that we would never have managed to do it otherwise. Since this continuity provides us the chance to make a great impact and make a change and a shift in behavioral behavior when it comes to breast cancer awareness and motivation about the breast examinations, and create a difference and a great impact when it comes to change of how people understand breast health, breast cancer, how much they are afraid of it, and how they can motivate themselves in order to get screened. At the same time, throughout these 8 years, we have this opportunity to implement projects and implement programs that are really focused on the needs of patients, breast cancer patients, and have all these programs in a consistent manner, which build the trust from the people to the organization and to the collaboration with TP. And at the end of the day, become this initiative, this collaboration has created this form of becoming this friend that we might all have, that will poke us on the shoulder and ask us, have you checked yet? And will not lose faith to us if we haven't, and will try to push us a little bit more in order to do something for ourselves. So this collaboration has been a great opportunity in a national level, and we have seen this in the data that we have from the participants at the race throughout the years, that I can definitely share with you whenever you want.
Thank you so much. So it seems that this long-term partnership means quite a lot between Alma Zois and NTP. What lessons maybe you could share for other organizations that would like to sustain similar efforts? How can we join the movement?
I'll start with something that runs into our organization from the day we actually were founded. We have this slogan that it is, we are here for you. And the notion of peer support and mutual support is very vital to the way we do things we do every day. And at the same time, at the Greece Race for the Cure, we have this slogan that we will definitely not going to change it for quite a long time, which is stronger together. And the word together means a lot to us. And that's what actually we try to give back. And I hope we manage to do that to TP as well, that whatever we have achieved, it's a shared achievement. Whatever we have done nationally, how we have changed the way people perceive breast cancer, how people have motivated themselves to get screened, is something that we do together. It's not that someone will come and will take part at the race for the cure or will partner with us for a year. It's something that we actually have done together, and we try to give that back to everyone to see what we have achieved together. So every year we try to inform our partners of what we have done together, and in a measurable way. And I think this is something that is a lesson that we have learned, and we will never forget it.
Excellent. Triantafilos, you mentioned Tipping Greece has been active in the Pink October campaign for a decade. How do you manage to maintain this momentum and avoid the typical fatigue that we could be feeling after so many years? So how do you keep the momentum year after year?
Good question, Clementine. Yeah, actually, all the initiatives, meanwhile, they probably, yes, they can be, let's say, not have the same success as the beginning. But as I said before, we saw in our real life, actually, we were witnesses how our employees' lives saved due to their participation to the Pink October campaign. So now it's part of our culture about protecting and supporting our people. We have seen it in practice. So we maintain the momentum by involving our employees and the community, which is very, very important. Reinforcing our action every year, we try to do more. Expanding access to screenings, we offer more screenings. We try to offer more screenings, not to our employees, but to their community, to their families too. Improving the process for the participants, try to improve the participation rates also and the education for them. Actually, with synergies like the Alma Zois, with our employees, we try to make the participation meaningful for our employees and maintain all these important things that we are doing. So for us, it's our part of our DNA now to participate and offer such things to our employees.
Dimitra, would you add your perspective as well on how we keep
Yes,
the
I second what Triadu said, and I think the key is education. Fear will be there in any case. We just need to master fear, educate ourselves, and understand that early prevention can make a difference. So it's really important to do regular checkups, to listen to what the experts have to say. Do not jump into conclusions and make this probably more painful than it should be. So, together with Alma Zois, the testimonials of everybody that has been through this tough journey, I think we can learn, get better, prevent the disease as much as possible, and remember that we need to change our lifestyle and the way we see things. It's vital. It's all together connected. So that's the meaning that TPs try to pass to our employees, because we need to take care of ourselves physically and mentally.
Yeah, and you highlighted that piece, and it's extremely important and probably not heard enough. That it's really the combination. It's not only physical health, but mental health is extremely critical as well. It's a combination, and all dimensions are integrated. Christiana, would you like also to share your perspective on how to maintain momentum and to keep educating and raising awareness on breast cancer, on prevention, on detection?
From our point of view, I think that in order to maintain the momentum is to try and have an approach that keeps up with people's needs, evolves the approach according to the people's needs, and at the same time remain authentic as an approach. From our perspective, I think that if we can answer the question why we keep doing this every year, for what reason, truly, why are we doing it? I think the how, in order to be creative and deal with the possible boredom that might come from every year awareness initiatives will come naturally. As Dimitra said, and it's very, very important, in the awareness campaigns, what we actually want to do is to, at the end of the day, to save lives. And by including real stories of people, of how they dealt, how they traveled through the journey of breast cancer diagnosis because of the early diagnosis. By encouraging participation in events, as you mentioned, as you come as a TP in the Greece Race for the Cure, is something that is a shared experience, and this definitely will never be boring to anyone, because it becomes personal, and at the end of the day, everything is personal. Because as you've said, as you mentioned, Clementine, breast cancer is it has a very high incidence rate in women, and not only in women, but the basic numbers are there. So at the end of the day, at some point, it might get personal, because in our circle, we all have to deal with a diagnosis such as that needs to be taken care of mentally, physically, and practical in any way. And that's what Alma Zois does every day.
Thank you, Christiana. As we approach the end of the session, I would like to turn over to Dimitra. If you could share maybe a testimonial or a memorable story that illustrates the real impact of our initiatives.
Yeah, honestly, I think joining the TP family for Race for the Cure is something more than an event. It's a celebration. It's a party. So considering that the cause is to fight a disease, the fact that we celebrate wearing proudly either our white T-shirts or, in my case, as a survivor, the pink T-shirt, is like a turning point in my health journey, if you understand the meaning. So preparing myself for the Race for the Cure is inspiring me to adopt a healthier lifestyle, improving my daily habits, organizing together with my colleagues the meeting point, the whole journey. So I'm deeply grateful for the opportunity that we have together with the company and Race for the Cure to participate, celebrating these moments together, fighting together. And I'm really grateful as well that for the people that have been around me and supporting me. Either this is my husband and family, or my extended family, as I like them to call them, my colleagues. So all together, we can fight this. We just don't need to be afraid. Let's do it together.
And that's a perfect ending message, very positive. We can fight it together. Thank you so much for you three, Dimitra, Christiana, and Triantafilos, for sharing this enlightening session today. And I see you soon, hopefully, for other sessions. Thank you.
Thank you.
Thank you, Clementine.